Hello, my name is Aubrey Reese, and I'm an occupational therapy student. We'll be going over the promotion of type 1 diabetes through occupational therapy. So the objectives for this presentation is how occupational therapy relates to type 1 diabetes management, the learning implications of type 1 diabetes with daily occupations, and educating and promoting advocacy for our clients. So why service and promotion is needed? So type 1 diabetes is a serious health condition. There's also a lack of education and knowledge that may impact well-being of clients. Then there's daily occupations that are also impacted by having type 1 diabetes. So what is type 1 diabetes? Type 1 diabetes is an autoimmune disease where the body's immune system destroys beta cells that produce insulin. Since the body no longer is able to produce insulin, individuals must manually inject or use a pump to receive insulin to survive. So this is just crucial for those that have type 1 diabetes because you must manage your type 1 diabetes, such as checking blood sugar levels and giving yourself appropriate amount of insulin in order to avoid emergency situations as well as long-term complications. Then type 1 diabetes also has no cure and must be self-maintained across one's lifespan in order to have a healthy life. So for the prevalence, according to Zugu et al., type 1 diabetes represents around 10% of all cases of diabetes, affecting approximately 20 million people worldwide. So what is the difference between type 1 and type 2 diabetes? Oftentimes we hear the term diabetes getting thrown around, which no one is really making a distinction between the two. So type 1 diabetes also refers to being insulin dependent, meaning an individual needs to manually give themselves insulin in order to survive, like I mentioned before. Type 2 diabetes is when the body is insulin resistant, where the body still can produce insulin, but not enough to break down the amount of sugars or carbohydrates consumed, which impacts the blood sugar. Type 2 diabetes can be managed through lifestyle changes such as diet and exercise. So, as I mentioned too, there's no cure for type 1 diabetes, but with type 2 diabetes, just making those lifestyle changes, you can consider it being a cure. Type 2 diabetes is also a more commonly known type of diabetes. So again, when we hear that term diabetes getting thrown around, it's often referred to as type 2 diabetes. So how occupational therapy can help. Occupational therapy, serving as a role in the healthcare team, can promote and successfully aid in the management of those living with type 1 diabetes. Occupational therapy can also assist with habits and routines and help individuals adapt to their environment with treating type 1 diabetes. Occupational therapy can also be considered important in type 1 diabetes management by creating a plan of care that can assist individuals with their type 1 diabetes management and improving overall quality of life by educating in appropriate interventions and encouraging self-advocacy with healthcare professionals or in any other setting that relates to the client. So now getting into the coordinated care team. So we have the client as the primary focus when it comes to the coordinated care team. And this client is an individual having type 1 diabetes. So there's quite a few individuals on the coordinated care team that can help out someone that has type 1 diabetes. So first, let's start with the primary care physician. These individuals will most likely be the ones diagnosing a case of type 1 diabetes, as well as referring out to other specialties. We also have the nutritionist or dietitian. They specialize in nutrition and dietary needs as well, which they can be educating on how foods are processed throughout the body, how maybe carbs and sugars affect blood glucose levels, and they also might provide education on nutritional facts or what to look out for when grocery shopping. Now we have the endocrinologist, which they specialize in the endocrine system, which type 1 diabetes is considered an endocrine condition. So endocrinologists do have some knowledge in type 1 diabetes. They might be the ones that you'll see on a regular basis they will look over your blood work, make sure everything is looking good. They might make some suggestions as far as your insulin therapy or any lifestyle changes that you might need. So you'll be seeing them on a regular basis, like I mentioned. Then we have a certified diabetes care and education specialist, which they have a lot of knowledge in diabetes in general, but they might be good to see after first getting diagnosed because there's a lot of information that you are going to be provided, and they might help break down all the information so it's not so overwhelming. They might be answering any questions that you might have. And I wanted to preface as well that any type of clinician can become a certified diabetes care and education specialist, just as long as you're following certain guidelines as well as getting appropriate care in type 1 diabetes or any type of diabetes for that matter. Now, for the occupational therapist, they can help with certain habits and routines, self-advocacy in certain settings, learning how to manage the different lifestyle changes when it comes to having type 1 diabetes. So they might be good just to help coordinate too, and communicating with all the different types of individuals on the coordinated care team. And then we have the school nurse. The school nurse will be the one that will be assisting in the school environment. So they might be assisting administering insulin at meal times, helping checking the blood sugar levels, as well as communicating with any other school personnel or parents or caregivers. And then we have the family and peer support, which they're the ones that are most likely going to know the client the best. So we want to incorporate them on the coordinated care team as well, just because they might know more than all of the others on the care team about that client. So now we're getting into the environmental factors. So when you have type 1 diabetes, foods and especially carbohydrates or sugar will elevate or even can decrease blood sugar levels. And that's when you have to make adjustments with insulin therapy and making sure you're monitoring it closely, especially around meal times. But there's other factors that can interfere with blood sugar levels in having type 1 diabetes. So illness or infection is one of those. So having illness like a cold or the flu or any other infection can cause blood sugars to rise. The weather can also play a factor into how blood sugar is at a certain level, which usually hotter weather will cause the blood sugar to rise, and colder weather can also cause the blood sugar to drop. Exercise is another factor to consider. So the different types of exercise and the duration of any type of activity can influence blood sugar. It could cause it to elevate or drop as well. Lack of sleep can cause sugar levels to fluctuate. And then stress levels can cause sugars to rise. So if you're an individual that has type 1 diabetes, and it's important to also consider these environmental factors. And it's important to always remember that these factors can influence anyone differently. Everyone's unique in their own ways. You also should consider what your blood sugar is at the time of, say, going into a hotter degree temperature, or even when you're about to exercise. So that's also something to remember. So occupations that are impacted, we have activities of daily living, education, social participation, sleep and rest, health management, play and leisure, and work. So for activities of daily living, these are activities oriented toward taking care of one's own body and completed on a routine basis. So how it relates to type 1 diabetes is eating and managing insulin to carbohydrate ratio. This is just making sure you're taking the amount of insulin for the amount of carbohydrates you're going to be eating. Also possibly needing to use the toilet more often. So if your blood sugars are elevated, usually this will cause you to urinate more. Personal hygiene being managed to avoid infection or illness. So just going back on those environmental factors and having illness and infection being one of those to cause blood sugars to rise. Just making sure you're taking care of yourself. And then bathing with technology. So usually when you have uh, any type of technology submerging in a body of water, say a bathtub, it can cause a continuous glucose monitor or even an insulin pump to stop working. That's something to keep in mind. One, for financial purposes, and for the other of it's no longer being able to tell the individual what their blood sugar is or give or administer insulin. And then also functional mobility being impacted depending on the state of blood sugar or the environment. So usually when you have a low blood sugar level, it causes a change in function, meaning you'll have some signs and symptoms of shakiness, weakness, maybe even dizziness. So just making sure that you feel better too, and that can cause your functional ability, functional mobility to be impacted. Now, education, these are activities needed for learning and participating in the educational environment. So having blood sugar within an appropriate range to avoid interference with the learning environment. So oftentimes individuals will have a continuous glucose monitor that has an alarm system that goes when the sugar is too high or too low, which is a great feature, but I think it could interfere with not only the child that has type 1 diabetes, but others around them. So it's good to keep that in mind. Also having food or glucose available for low blood sugars. So just making sure that you have some juice or sugar around is good, just to avoid any emergency situations. Having medications and supplies stored at a safe place so others can't access it, and then having colleagues, classmates, and education staff aware of the diagnosis and significant signs and symptoms that interfere with one's quality of life. So just making sure everyone's educated within that school environment, knowing what to look out for, say for a low blood sugar level and when to act for that case. And then having food consumption monitored if needed. So again, if you give the child a certain amount of insulin, making sure they're eating the appropriate amount of food for that medication that was given. So social participation, this is activities that involve social interaction with others, including family, friends, peers, and community members, and that support social independence. So this relates to type 1 diabetes, of feelings of loneliness, isolation, and lack of relatedness. This could also lead to feeling embarrassed, maybe not wanting to give yourself insulin for the as that individual having type 1 diabetes in front of their friends, and then this leading to avoiding proper management when around their peers. So sleep and rest, these are activities related to obtaining restorative rest and sleep to support healthy, active engagement in other occupations. So relating to type 1 diabetes, needing to check blood sugar levels during sleep time hours. This can not only relate to the individual that has type 1 diabetes, but also maybe parents or caregivers as well, checking sugar levels in the middle of the night. And then also having low blood sugars, needing to wait for blood sugars to return to the appropriate range before going back to sleep. So as I mentioned a little bit before, having low blood sugar levels carry having those signs and symptoms and not feeling the best. And if sugar levels go even at a level that is too low, you can lose consciousness. So it's important to wait a certain amount of time for those sugar levels to go up, maybe eating some sugar, and watching that sugar level go back to appropriate range before going back to sleep. Now, health management, these are activities related to developing, managing, and maintaining health and wellness routines, including self-management with the goal of improving or maintaining health to support participation in other occupations. So self-managing blood sugar levels, making sure you're having a routine and developing those habits of checking your blood sugar, counting carbohydrates and detecting appropriate carbohydrate to insulin ratio. This is just making sure, again, you're taking amount of insulin for the amount of sugar or carbohydrate you're eating. Also attending healthcare appointments and making sure you're keeping in contact with your coordinated care team. Also taking medication when needed. So not only taking insulin before meals, but also adjusting your blood sugar levels by taking insulin if your sugars are too high. Now, play and leisure. So play is activities that are intrinsically motivated, internally controlled, and freely chosen, and may include suspension of reality, humor, exploration, risk-taking, celebrations, and contest. Leisure is non-obligatory activity that is intrinsically motivated and engaged in during discretionary time, that is, time not committed to obligatory occupations such as work, self-care, or sleep. So this relates to type 1 diabetes by just being aware of your blood sugar levels during activity. Also being aware how the environment impacts the blood sugar levels, just going into those environmental factors that I previously mentioned, and then being content with performing sedentary activities. This is just knowing your body, being aware of how different activities may influence your sugar levels. So just being okay with maybe doing something not so active. And now work, which is labor or exertion related to the development, production, delivery, or management of objects or services. Benefits may be financial or non-financial. So this relates to diabetes, type 1 diabetes, by incorporating checking blood sugar levels throughout the workday, having your medication and supplies in a suitable location so others can't access it, being able to take breaks when appropriate, and having food or glucose available if needed for low blood sugar levels. I think it's also important to preface having your coworkers and your other colleagues being aware of your condition, as well as the workplace being okay for you to take breaks when needed, and really advocating for yourself. So assessment tools used for type 1 or occupational therapy to assess individuals with type 1 diabetes. So we have the type 1 diabetes distress assessment scale. This is a two-part assessment for adults living with type 1 diabetes. The first part is a core scale, which has 8 items, and this assesses the emotional experience of diabetes-related distress. There's also the sources scale, which has 22 items, and this assesses relative impact of 10 common sources that may be driving the distress. There's also more assessments that you can find on behavioraldiabetes.org. These assessments include for individuals that have type 2 diabetes, adults with type 1 diabetes, partners of adults with type 1 diabetes, parents of teens with type 1 diabetes, hypoglycemic concerns, and device satisfaction. So now for the need for advocacy. Advocacy is a vital tool for individuals with type 1 diabetes, empowering them to navigate healthcare systems, access resources, and promote awareness. Self-advocacy begins with understanding one's rights and needs and effectively communicating these to healthcare providers, employers, and others. Discussing accommodations for diabetes management in educational or workplace settings, asserting the importance of regular medical appointments and access to necessary medications and devices are also important. Advocating for oneself extends to promoting broader awareness and understanding of type 1 diabetes with communities, eliminating myths, and advocating for policies that support diabetes care and research. So by eliminating myths, maybe discussing the difference between type 1 and type 2 diabetes, making sure that no one is stereotyping what it really means to have type 1 diabetes and things like that. And then also by speaking up and sharing experiences, individuals with type 1 diabetes can drive positive change, ensuring their voices are heard and their needs are met. Thank you for listening, and I hope everyone has a great day.